welcome to Mental Health, the Crisis of Our Time. My name is Ann Bergen. I'm the host of this series of programs. As part of Franklin TV's mission, it's really to inform and to educate and to make the community aware about important issues that are impacting its residents, its citizens. And for years, I've done programs focusing on the mental health and emotional well-being of adolescents. As a public educator for many years in different roles, I have found that to be incredibly important, and that will continue. But lately I've begun to sort of broaden my focus and realizing that when I look at the data, at a different set of data, mental health is really the epidemic of our time, and it's impacting people of all ages, all socioeconomic backgrounds, but especially seniors. And I wanted to share a few statistics, which for me I found quite unsettling, that 1 in 5 seniors is experiencing some type of mental health issue, including depression, anxiety, substance misuse. Older men have the highest suicide rate of any age group. The rates of alcohol misuse are skyrocketing, as have prescription drug misuse. 1 in 10 seniors over the age of 60 are victims of elder abuse. Almost 90% conducted by family members, and only 1 in 24 of those incidents are ever reported to authorities. So when I look at it, when I think about it, it's seniors have raised families, they've been our teachers, our builders, our lawyers, they've served in the military, they've served on boards, they are sources of wisdom and experience, but just now too many are suffering. And one thing I want to make very, very clear is there are so many vibrant seniors out there actively involved in the community, but my focus, the focus of this particular program, is to focus on those who are most in need. And to that end, I think it was Gandhi who said, and I didn't know him, I'm not that old, but he said that a community, a society is judged by how it treats its most vulnerable. And we are so happy today to have as our guest Raeleen Gallivan. It's Gallivan, that's how I'm pronouncing it correctly, who is the Social Services Coordinator for the Franklin Senior Center. And she is one who has devoted her life's work to helping, again, those who are most in need. So thank you so much for coming. I know you're busy, and to come and to give us your time here today. I really appreciate it. And I wanted to start off by asking you just to tell us a little bit about yourself and sort of your story and how you ended up being in this role.
Okay, well, early on, I grew up in Worcester, and I lived in a 3-decker with my family. My uncle was on the first floor. He was in his 70s, and I spent a lot of time with him. I would go downstairs. We would watch Johnny Carson. He would give me pens, paper. So early on, I just enjoyed working with seniors, being with seniors, listening to seniors. I had to have been about 10 years old, but that was my life. And then from there, my mom was a caregiver to her mother, who had a disability. She was a double amputee, so wow. I spent a lot of time with my elder grandmother, and just then I knew I had a calling for helping people, and I had so much fun doing it. I would be the errand girl running to the store, getting her, chocolate, or doing her hair, getting her pills, and I think that just set the stage by really enjoying helping people and just a love for seniors.
Wow, it's so important because you said all kind of the right words. You use words like listening and enjoying, and when people know that they're cared for and that they're seen, no matter what age, that matters a lot, doesn't it? But yes. I think one of the things I want to do with this program too is just to call attention to the gem the senior center is in our community, and as social service director, you connect people to resources. You provide resources. Can you talk a little bit about some of those resources, the services that are provided for seniors that sort of just make their life easier, and when you consider some of the challenges that seniors have. Can you speak to that? Like, I'm thinking, like, to start, like, with fuel assistance, and can you just kind of talk about some of those services?
A senior will come in and sit down, and first we'll start off just talking about life, general questions, how's everything going? Then the senior might say, oh, well, money's tight, and from there I'll say, oh, you know, what's going on? You know, what's your income? Get an idea of what they might qualify for. And then from there, I'll introduce maybe food stamps, see if they qualify. I'll go over the guidelines, do an application with them, and then ask questions about their heating source, see if they will qualify for fuel assistance or if they're open to it. I'll look to see if they're getting any deals with their internet service, if they need any other resources, such as in-home care services. So from there, you know, I typically spend maybe about an hour with them just to review their needs. And we'll have discussions, and then from there to say if they're having a hard time mentally, if there's some issues going on, I can refer to certain programs that can do evaluations. So we do offer a lot at the senior center.
It's true. I was looking at some of the things, for example. Now, here's one that I wasn't aware of, and it talks about like a legal referral to a legal helpline. What might be some of the issues that would surface that someone would need access to a legal helpline? Can you speak to that?
Yeah, there's a variety. There's times where somebody might come in, they're having difficulty with getting their pension, there's some issues going on, legal issues, they don't know why they're not receiving it, so I will give them the contact information. We also have legal services that come into the senior center once a month.
You do? Oh, I didn't know that.
Yes, once a month they come in, so we'll put them on the list. Sometimes there's a wait list if we can't get everyone in, but that was one situation with, you know, having difficulty with getting their pension. And then also too, with the housing crisis right now, that's been troublesome, some evictions.
Can you speak a little bit more about that? Because that's a huge issue, isn't it, the housing crisis?
It is a huge issue.
Yeah, just talk a little bit about that, because,
the difficulty is people can't afford the rent. So that's what's trying right now. I have seniors that come in and they have their Social Security, even if they have a pension, you know, if they're not in housing, they're still paying taxes, they're still paying you know, their electricity, whatever goes on in their, you know, life. But it's just really trying times because a lot of these seniors are living off their savings, just with the rise of food, everything. You know, the rents, they can't afford the high rents. And right now there is a long wait list for housing.
That's it. And again, I'm trying to learn as much as I can from my conversation with you, and it's sort of like just making the community aware of the needs and where we need to put services. Housing is crucial. And then we think, you know, we've got, and you know, it's kind of a wonderful thing that sort of the migrants have come to, you know, and housing needs to be found, and but the wait list for it, and then it's years, and then and I'm going to be talking to Shannon from the Veterans Services and talking about homelessness around the issues that veterans are facing as well. So when this is such an important conversation. I really appreciate your calling attention to that. The other thing is. One of the other ones is that I wasn't aware of, and maybe you can give us more insight into this, is the whole idea about tax deferrals. Can you speak a little bit about that? That if people can't afford the taxes, I think water and sewer, there's some kind of a deferral system I saw listed on the website.
There are programs. You have to meet the criteria. There are guidelines. You have to fall under the criteria, but you can get tax breaks with that. So we do have the paperwork for that. Review,
Good to know.
You know,
Good
the
to know.
eligibility guidelines, things of that nature.
And I did see which I thought was really kind of cool. And again, this may not be an area that's you oversee or that you're aware of, but the whole idea of for people living with dementia, that there are kind of tracking devices or that are available so that if someone wanders, that Can you speak a little bit about that, or is that
Yes,
something? Yeah.
no, we handle a lot of cases where a client does have dementia. We will refer to agencies where they can go out, do an assessment, see what services they qualify. There's lifeline programs where you can, call directly, set up with the different type of emergency buttons that they do have for tracking. A lot of that is paid by insurance. So that's why it's good to, have an evaluation done. I make a lot of referrals to the nonprofit agencies that go out there and do assessments to see what services people do qualify for.
That's great.
But yeah, that's a great program.
Yeah, good to know. That is. And then the last one I wanted, because just to make people aware of that, again, I wasn't, when you think about some of the people who no longer drive and they need to get to medical appointments, and can you speak to the services that are available for people who,
Yep, we use GATRA in this town. That's a great resource for seniors. They will take you to medical appointments. There's also volunteers. The program FISH
of
for
course.
transportation. That's a great program. They assist as well too.
Right.
Dial a ride. You can call in, schedule appointments if it's not within Franklin. Transportation is a great thing for seniors. There's also Tri-Valley that can assist with transportation. They have a grant, so if they can't get transportation within the town, Tri-Valley can assist. They can call directly as long as they schedule ahead of time. But
That's great.
That's big, transportation.
that how now is are there enough volunteers? Is that something that FISH needs more volunteers, or do you feel that the need is met there?
I feel like a lot of seniors use GATRA
GATRA.
transportation, so I think that's a great asset here in town.
I just remember back there was a dementia awareness group that I sat in on a few times, and the GATRA drivers I found to be incredible.
Yes.
Compassionate.
Yes.
They get to know the people. They're kind of an extra set of eyes. I just found that it was really inspirational. I said, boy, they're unsung heroes.
Yes.
Would you agree with me on that?
I agree.
Yeah.
The GATRA drivers come in. Okay, Bob, let's go. They know everyone by name. It's great.
And it's another connection that people have. When you just said it, they know my name, right? I mean, just to say it, it's just another thing. I just found them to be incredible.
Yes.
But now the focus again on mental health. Now I want to. There is a Gail, a counselor that people can call into. Is that how that works? Can you speak a little bit about, given the level of mental health needs? Speak to us about that one, about the call-in for mental health.
Yep. So that's an emergency mental health outreach team, and Gail is part of that. So she's a clinician that works directly with clients who need emergency medical help. So it would be more if somebody's in crisis, if they're having some issues such as chronic stressors in their life, if they're having anxiety, depression. It's for acute care. So they would call up, they would speak to Gail, she would be able to assist. They have outreach workers. There's also life coach that she's working with the program. They can call the senior center. I can make the referral to Gail if they don't call themselves. But it's a great program. The only thing right now is there is a wait list.
That's what I was going to ask you. Yeah.
Because of the demand for mental health. So it's just a across-the-board issue.
Well, it is, and it impacts adolescents, their wait lists to get help, and it's just, to me, that's another one. Okay, we'll look at, the number of unhoused, the wait list for housing. We look at, the need for, for sources for mental health. We have to, because that's a huge issue. So, but one of the things I was going to ask you is, given the rise of sort of alcoholism, and it's everywhere, but it's also when people are lonely or isolated that alcoholism can become more of a problem. What about access to things like AA for seniors? Are there any AA groups that come or that are focused just on the needs of? Is there anything like that out there, or that you know of, or?
I have not seen a lot of substance abuse. I've been very fortunate with the seniors that I work with. But if there was a situation, I would refer to the safe coalition that I spoke of.
Exactly, right.
But yeah, I would refer to the MHOT program, you know, with Gail. I would do that.
Beautiful.
But I haven't really seen a lot of substance abuse.
Right.
There are, you know, support groups that are available. I do have those resources.
That's excellent. Good.
So if I do speak to a senior that is having an issue, I will give them the information for the support groups, AA. You know, I know there's local ones in Milford and all that are available.
So in many instances, it would probably be might be a family member who would contact, because, you know, to say, I think my parent or my whatever, my spouse is struggling, how can you help? So it might be, you know, one of those who calls you. So, but here's my question to you is, and you've given me part of the answer to this, is it's sort of getting information out to people.
Yes.
So that they know the services are there. They know that there's an outreach when they're, or family members who know that their family member is struggling and they're desperate to find help. How is that information getting out? Where can people find this other than the sort of the senior center website? Are there, is information getting out to the food pantry? Is it getting out on, you know, different locations? Can you speak to that a little bit about?
Yes, I think we work well as a community here in Franklin. I work with Laura Dew over at the food pantry.
Oh, you do?
So,
yes.
Great resource.
See, that's great. I didn't know that. That's great.
Yeah, St. Vincent's de Paul as well too. Great community. So we all work together. We're all on the same page. So I get a lot of referrals from the food pantry, St. Vincent's de Paul. A lot of referrals. So we're all on the same page.
How about, I was just curious, someone brought this up to me, a conversation I was having. How about, when you think about it's physicians often who become aware of some of these issues, just like in schools, it's school nurses that sometimes be the ones. And obviously there's HIPAA stuff, but do you get information out to doctors' offices about the services that are there so that they can say to their senior, you know, patients? Is that something that...
I haven't done any marketing and networking towards physicians, but I know the physicians a lot that have called in are aware of what senior centers do.
Right, that would make sense.
So they do refer to the senior
I was just
centers.
Curious.
Yeah.
They know, right?
Which is great.
Yeah, that would make sense because they know. They know the places to call. And all right, so I have another question for you. This is one that is weighing on my mind. Now, I have a friend who has been diagnosed with dementia, and she's getting wonderful. She doesn't live in Franklin, but she has wonderful services. But it's her husband who is also his in remission from cancer, who is falling apart taking care of her. I have a friend whose husband went into a nursing home at an early age. She's living with guilt and shame and all of the you know, trying to navigate a nursing home. He's doing okay. She's falling apart. I have another person I know whose spouse is struggling with in the terminal stages of cancer. He's falling apart. So the question is, in terms of mental health services, support services for caretakers, can you speak? Do you see it as a need? Is there anything that's being done in that?
I have definitely seen a rise with dementia. There's a lot of people coming into my office, unfortunately, who a family member is going through the diagnosis of dementia. So there is a caregiver support at the senior center that goes in twice a month, the second and fourth Wednesday, which is a great support for caregivers. Then there's also caregiver programs. There's a great program with Tri-Valley Elder Services. So I do a lot of referrals to the caregivers program there where they can work directly with individuals. So there's a good amount of resources there. We have the Sunshine Club.
Talk about the Sunshine Club.
The Sunshine Club at the senior center. It's a great thing. So it's people who have cognitive issues, any chronic illnesses. It's a great program. They can go Monday through Friday. It's wonderful. They're engaged. They have activities. We have, you know, the cafe there. They have healthy, balanced meals, entertainment. It's an amazing program.
Yeah, that's great. That's good to know. Yeah, that's very good to know. And there's also the whole idea about grandparents raising grandchildren. Do you refer people to that?
Yes, I do.
Because that's become a big issue, hasn't it?
Yes. Yep. I worked with a client a couple months ago, and she was just so overwhelmed. She was a caregiver to her husband, as well as raising her, grandchild. So I was able to give her some resources to connect her with programs specifically for, grandparents and the struggles that they might encounter.
I think that's something that the community needs to know more about is also, and that's something certainly that the Safe Coalition focuses a lot on. That's sort of like one of the fallout from substance misuse is when parents can't raise their kids, and then grandparents who are, heading into retirement, and then all of a sudden their lives are turned upside down, and to have support for them, because this is just the reality. It's the way it is, So, but what I was going to ask you is sort of, from your perspective, and when you look to the biggest needs out there, what overall would you say? Again, magic wand, and we can do more for seniors. What would it be?
Right now, I think there's a big shortage of workers in the health industry. So across the board, homemakers that go into the homes and help them, there's just not the staff to help them. So that's one thing I think we can work harder at, trying to get people in that field, as well as shortage of mental health care professionals.
Right.
That's across the board. Shortage. People aren't going into that field anymore.
Yeah, that's right. They aren't. And maybe, we've got to sort of kind of convince people that you're needed here. But
exactly.
So in terms of sources of funding for you, what do you rely on for funding? There are local funds for state funds. Can you speak a little bit about the supports that the senior center gets and how the sources of funding, and do we need more funding is the question.
I haven't really handled a lot of the funding.
Sure.
I know that's more the director doing all the funding. I'm kind of like in the back part of it, working with the clients directly. So I'm not really sure where the majority of the funding comes from. Social services is so busy, so I'm literally
you're dealing with
application and faxing and trying to get all the resources.
It's a big job, isn't it? But you love your work, don't you?
I do.
Yes,
you do. It's rewarding. It's fun. Every day's a different situation. I love to meet people, help people. Knowledge is power. Anything we can do to help them remain independent, mentally well, physically well.
Right.
It all goes together.
And I just think the more we call attention to the resources that the Senior Center provides, and I want to thank you because, to give up your time to come here today. But this is really important, I think, to get this information out. And like I say, from you, I learn a lot. And then I have, through Franklin TV, we can kind of get the message out and support you in any way we can. So
excellent.
I just wanted to say thank you very much for being here today. And I also want to thank Chris Flynn, our producer here, and to let people know, for Franklin TV, I am Ann Bergen. Thank you very much for watching.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.